Yeah, so cost effectiveness is a really important issue. In fact, the guidelines have even incorporated value statements now in the US guidelines that um, provide various value indications for each therapeutic class. And so this has really risen and furthermore, risen in priority at the community level. And furthermore, it's really, really important for um, especially payers, insurers, to understand the value added of therapies. We can show in terms of clinical trials that these therapies can improve clinical outcomes, but can they do it at a price point that is acceptable to the community at large? And so that is where cost effectiveness analyses that balance the efficacy that's seen in clinical trials with the pricing of the drug, as well as other cost inputs like averted hospitalizations, like um, averted needs for certain medications, for instance, in a total balance sheet to allow us to understand what is the true value added of a therapy. Now, with the SGLT2 inhibitors, and with any therapy, cost effectiveness is going to be dependent on the region, the country, the health system that is providing that therapeutic intervention. For instance, pricing, of course, may vary in the United States compared with Canada, compared with Europe, Asia, etc. And so cost effectiveness really also needs to be performed in each region-specific context and has been done with the SGLT2 inhibitors. And in general, the cost effectiveness values have actually varied. In fact, in certain settings, like in Europe and in Canada, cost effectiveness thresholds have been met. And these have been thought of as high value additions to the heart failure armamentarium. In contrast, in the United States, the price point of SGLT2 inhibitors without discounts and without recent evolution in pricing is quite high. And so because of that, the cost effectiveness has been estimated at more moderate levels. And so in terms of when indexed to US community acceptance thresholds. And again, these are very highly sensitive. The cost effectiveness is most sensitive to the drug pricing. And so if the drug is, of course, priced at a lower price point, then it might be more cost effective. And we've seen a lot of evolution in this space on US pricing of SGLT2 inhibitors. There are now 6 FDA-approved SGLT2 inhibitors. And some of them are priced at a lower price point. For example, bexagliflozin is priced at less than $50 a month for a 30-day supply. And so you could kind of get a sense that if you do input lower cost SGLT2 inhibitors, then you may improve the cost effectiveness margins here. Furthermore, we've heard that the Inflation Reduction Act has identified 2 of the SGLT2 inhibitors, dapagliflozin and empagliflozin, as 2 of the top 10 medications that are going to be primarily negotiated by Centers for Medicare and Medicaid with direct pharmaceutical companies to lower the price point. And those new prices are anticipated to be rolled out for Medicare beneficiaries in the beginning of 2026. And then finally, we've seen that the SGLT2 inhibitors, again, because they're not new to the drug landscape, are approaching generic availability. And in fact, even for some of the early SGLT2 inhibitors, we've seen now generic options become available in the United States. And so all these factors are anticipated to drive down the prices of SGLT2 inhibitors in the United States. And because of that, I think that margin of cost effectiveness that's currently assessed as moderate is going to be a high value addition very soon. Yeah, I think think that cost saving really comes from the regions in which SGLT2 inhibitors are priced at a lower price point, and are much more affordable. For example, in Canada, pricing is quite low. And because of that, most cost effectiveness analyses have found that if you add an SGLT2 inhibitor to a patient's medical regimen, it's likely to save that cost downstream because of the averted hospitalization, averted healthcare utilization may actually offset any incremental pricing that the actual SGLT2 inhibitor costs. I think that as the affordability, accessibility, and insurance coverage of SGLT2 inhibitors improve at a global level, because of their ease of use, these therapies can actually be implemented quite broadly. We've seen that the uptake of the SGLT2 inhibitors has actually been quite rapid, at least in compared with other therapies. And I think that because of that, one of the primary reasons for that is that these therapies are commonly used across therapeutic disciplines, that many different clinicians are familiar with them. They're indicated for different disease states. And they're also, as we discussed, easy to practically implement. And so for all these reasons, if the affordability and accessibility can improve, I think we're going to see really widespread uptake of these therapies.